Hi, my name is Elizabeth and I'm a physiotherapist at Core Concepts. In the last video, we talked about what diastasis recti is and why it happens. In this video, we'll be discussing how you can tell if you have diastasis recti. It is normal to have abdominal separation after pregnancy, and this usually resolves within 6 to 8 weeks. However, if it doesn't after this period of time, this is how you can tell whether you still have a diastasis recti. Here's how you can assess for yourself at home whether you have a diastasis recti. Start in a lying position on the bed and bend your knees up so that your feet are comfortably on the bed. Okay, from this position, what you can do is place the fingers around 2 centimeters below the navel and feel for a separation between the left and right abdominal muscles. You may be able to feel a slight indentation in that area. Now, what you want to do next is bend your head off the pillow while still feeling in that same area. If you still feel a 2-finger separation, then this is a sign that you may have diastasis recti. You can repeat the same process 2 centimeters above the navel, again feeling and bending up. Now I'm going to teach my model how she can feel for that separation on her own. So you want to just place your fingers directly over here. Yeah. Press slightly into the skin. Can you feel that slight indentation there?
Yeah.
Okay, now gently lift the head off the pillow. You should feel that that slightly closes.
Yeah.
Yeah, okay, and come back down. You can repeat that process on the 2 centimeters above the navel, again pressing into the area, lifting up, and coming back down. In most cases, diastasis recti doesn't have a severe impact on the body's function. However, in some cases, it can cause disruptions and pain into the back because of the weakened core muscles. Apart from physical discomfort, rectus diastasis can cause an impact on the physical appearance of a new mum. This can have an impact on their self-confidence, especially after delivery, because it still looks like there's a pouch and you may still look like you're pregnant even after delivery. This may be an additional source of stress, especially for a young mum who already has a lot that they're handling at the time. Thanks for watching this video. In the next video, we'll be talking more about how physiotherapy can help you if you have diastasis recti. And don't forget to like and subscribe.